Polypharmacy in older adults is a growing problem in today's America. It is defined as the ingestion of 4 or more medications. Taking multiple drugs at the same time increases an individual's chance for adverse drug effects, or ADEs, due to potential drug accumulation and interaction. ADEs take a big toll on the healthcare system and well-being of affected individuals. Instead of serving their therapeutic role, medications involved in these events can actually harm patients. Studies show that about 17% of elderly hospital admissions are related to ADEs. In addition, the cost of ADEs per person per year is $335. Multiply that by the number of older adults in the USA, and the healthcare costs of polypharmacy can be staggering. Studies also show that there are not good enough interventions. Funding is needed for an innovative approach to polypharmacy targeting the elderly population in Charlotte, North Carolina. The proposed approach will utilize 3 different levels of interventions from a public health nursing standpoint: individual, community, and system levels. At the system levels, changes will be proposed through Medicare. Medicare was chosen because its span of influence covers both the elderly and the prescriptions they receive. Funds are needed to fully develop, prepare, and present to Medicare the following policy changes, where all pharmacists would be required to review medications of patients with 5 or more prescriptions. Because the pharmacy is the last barrier between patients and filling in meds, this would be an effective change to monitor individuals' correct use of medications. On the community level, in continuance of the Medicare policy change, the pharmacist will also be required to provide a referral for this group to a public health nurse. The referral will be made by the pharmacist after a medication review, where changes to the regime will be made if possible. The public health nurse will then be notified of the group of people who meet the criteria through an email, which provides all contact information of the patients. On the individual level, a community nurse, based upon a referral from one's pharmacist, will make a home visit where an assessment will be made on the patient's ability to manage one's own medication regimen. The community nurse will also provide education on and demonstrate the use of pill boxes that help organize one's medications. Funding is needed to implement public health nursing interventions that will not only provide significant returns on the investment, as $500,000 can be saved on healthcare costs associated with ADEs, but also significantly improve the quality of life for many older adults by reducing polypharmacy events. Through health education, 1,500 individuals will be affected specifically at the individual level. At the community level, over 23,000 older adults in Charlotte, North Carolina will have the potential to be reached. Through Medicare policy development and changes, potentially 41% of older adults in the USA will see an improvement in quality of health care. A relatively small amount of $50,000 has the potential to significantly impact a large sector of USA's healthcare delivery and begin a nationwide